Venosus ASD of SVC variety. In this image, this is bicaval view. This is IVC, inferior vena cava. This is right atrium. In opposite to inferior vena cava, this is superior vena cava. And this is left atrium. And this portion is ASD. So this case is sinus venosus ASD of SVC variety. First of all, how to make this bicaval view? Simply in sagittal plane, in subcostal zone, subcostal window, sagittal plane. Sagittal plane, simply angulate the probe towards head, cranial angulation, without changing the plane, same plane, without maintaining the plane, sagittal plane. If you make, then you will get this kind of image. This is left atrium, this is right atrium, this is ASD, and this is IVC, inferior vena cava, this is SVC. And this is right pulmonary artery branch posterior to superior vena cava. So this is left atrium, this is right atrium, this is ASD. So this is sinus venosus ASD of SVC variety, because you see, if you just close this one, then SVC will drain direct into right atrium without touching this ASD. Just close this one and make this one, remove this one, then that will be the ASD of IVC variety, because that will be close to IVC. So this is SVC type. If this suppose this part is intact and this part is deficient one, then that will be IVC type of sinus venosus ASD. So whenever you have any kind of confusion, right atrium, right ventricle enlargement, you have to find out sinus venosus ASD, because normal location of interatrial septum is not giving you any sign of ASD. In that case, just make bicaval view. Or how to make bicaval view? Simply in the sagittal plane, in subcostal window, angulate the probe maintaining the same sagittal plane towards head. Towards head, that means towards superior vena cava. You will get superior vena cava also, because very often you have seen the inferior vena cava in long form, long axis. So this is called bicaval plane obtained through subcostal window. This part is deficient, then sinus venosus ASD of SVC variety. This part is deficient, then sinus venosus ASD of IVC variety. So this part is deficient, the deficiency near the IVC, and this part is intact, then that will be IVC type. If this part is deficient, as you see in this case, then that is SVC variety. So in case of sinus venosus, location is always near the either SVC or IVC. So location wise near the SVC and right atrium. In case of sinus venosus ASD of SVC type. So sometimes what SVC overriding the superior border of interatrial septum. Pulmonary vein abnormality is always present. So when in case of sinus venosus SVC type and IVC type, there must be pulmonary vein draining directly into right atrium along with this IVC or SVC. So simply next image by C. So right side, as you know, this you are seeing the right side portion of the left atrium right wise, because you are trying to find out ASD. Here the right portion of left atrium you are being. So if this part is deficient, then right lower pulmonary vein is draining into right atrium. If this part is in this case, then right upper pulmonary vein is draining into right atrium. So if this part is deficient, that is IVC type sinus venosus ASD, then right lower pulmonary vein is draining into right atrium. If this part is deficient, then right upper pulmonary vein is draining into right atrium. So that is the point to know. So sinus venosus ASD is always having abnormal pulmonary venous drainage. In case of SVC type, right upper. In case of IVC type, right lower. Because this left atrium portion is the right right side, because IVC is on the right side of the structure. Compared to aorta, IVC is always right side structure in the abdomen, in subcostal window. What you see, the IVC is right sided structure. SVC is also right sided structure. So this portion of right atrium is having, this portion of left atrium is having right sided portion of left atrium. So this portion always has abnormality of, if this portion is absent, that means superior portion is absent, then right upper pulmonary vein is draining directly into right atrium through SVC, with SVC, along with SVC. It sinus venosus ASD of IVC type, then right lower pulmonary vein is draining into right atrium. That is the point to know from this video. Next image, again the same thing. So this is left atrium, this is right atrium, this is ASD, this is SVC. As the ASD is near the SVC, so sinus venosus ASD of SVC type, not IVC type. If this part is absent and this part is intact, then that will be sinus venosus ASD of IVC type. Now see the color flow left atrium to right atrium, left to right flow. You see the color flow. You can easily see this is flow. This part is intact. Here you see the right atrium, right ventricle severely dilated compared to left atrium, left ventricle. This is the typically view in which normally book has written how to find out sinus venosus ASD. This view is also obtained through subcostal window. That is little bit coronal view. Obviously all the views are between sagittal and coronal plane that is in between sagittal and coronal. What you see in this case, just want to, this is right upper pulmonary vein draining into right atrium. So right upper pulmonary vein draining into right atrium. If you find this kind of thing, always there must be sinus venosus ASD. And the same thing, bicaval view, left to right flow. This is left atrium, this is right atrium, this is right atrium. Four chamber view. Normally book describe this kind of view. This is left atrium, this is right atrium, and this is ASD. This is right pulmonary artery branch. This is bicaval view. This is left atrium, this is right atrium, this is IVC, this is SVC. And this is right pulmonary artery, this is SVC, this is left atrium, and this is ASD, this is left atrium, this is IVC. You have to angulate more in this, maintain the same plane. Rational long axis view, this is left atrium, left ventricle, this is right ventricle, this is aorta, indicating right ventricle severely dilated. You see the left ventricle becomes D-shaped, indicating raised right ventricular systolic pressure. Not typically D-shaped, it means at least moderately raised. You see this right atrium, right ventricle severely dilated. Same thing, bicaval view, left to right flow. Just looking all these images. So ultimately this is the case of sinus venosus ASD of SVC type, because this portion is deficient. If this portion is intact and this portion is deficient, then that will be IVC type. So whenever you find sinus venosus of SVC type, then there will be right upper pulmonary vein draining into right atrium. IVC type, right lower pulmonary vein will be draining into right atrium. Thank you.